everyone. So, as many of you know, I have cystic fibrosis, and that often requires to do IV antibiotic treatments, which is actually fairly normal for patients with CF. We call them having a tune-up. So, excuse me. I thought I'd show you the process of how we do that. You can see I'm not in a hospital. I'm home. So I hook up all of my IVs myself. So right now we're getting ready to do my amikacin, which is 700 milligrams, which just got increased. It was 650. Now it's at 700. So we're going to get that set up right now. I have my little travel cot thingy. It has all my IV supplies in here that I need to hook up my IV drugs. In it has my alcohol wipes, saline and heparin flushes, and hand sanitizer. Always important. So, what we're going to do is get the IV tubing ready. This is a one-use thing, so as soon as that drug is done, then this gets thrown away with it. Excuse me, again. That's probably going to happen a lot more times, so. So now get it out of the package. I'm going to straighten up the line. And then one of the first things I'm going to do is move this clamp that's usually almost always up to the top, which when it's hanging is not convenient, so I'm going to move it down to the dial. I'm going to clamp it. The drug is run by gravity or by drip, not through IV pump. So this dial of flow is it's called, has different settings on here that controls how fast or slow the medicine comes out depending on the drug and the dosage. So get that clamped. I'm going to take the IV bag, hold it upside down, and pull this plug. Take the protective cover off of this. That's how you do it, and insert. And this is the reason why you clamp this first, because now you have to turn this right side up. And I'm going to hang this on my IV pole. Show you. IV pole. How did you do that? And then I'm going to squeeze the chamber so that half of the fluid is in the chamber. As so. Raise it. Now the other thing I want to make sure is I'm going to have to flush the line so that We'll open it up so that the IV fluid flows and drips out the end, making sure that there's no air bubbles anywhere in the line. So that looks pretty good. Air bubbles going into an IV line is bad. So now I'm going to prepare my IV that's on me to meet this IV line. Now, as you can see, I have no peripheral IVs. I don't have a PICC line. What I do have is called a port, or infuser port. And the device that's below my left clavicle, and there's an IV line that you can't see that's in me that goes where it's supposed to. So now I'm going to tap my hands. I'm going to prepare saline flush. And when these come, these have like an air pocket at the top. So we gotta break that seal. To make sure that I'm not forcing any air into the line. Take my alcohol wipes. I'm going to wipe the blue cap. I'm not touching it with my hand, even though I clean my hands. Push in, screw, unclamp, and then just push the saline through. I'm going to take another alcohol wipe, wipe the cap again, grab the IV tubing, and on here there's another protective cap. Just gotta remove that. Cooperative. Something's not. There we go. Again, it's a push in, and then this part screws. Now, that dialer flow. It's always set on open so you can flush the line. Now before I unclamp, I have to adjust to the proper setting according to medication. Which is at 250 milliliters an hour. So I'm going to unclamp both lines. And that will take 1 hour to go through. And periodically I will check the bag, count the drips, make sure it's still consistent, check the line to make sure there's no sudden air bubbles or blood return. That hardly ever happens, but still gotta check. So that will take 1 hour to go through. Other things that we have to do as CF patients is, well, I'm sure everyone knows what a nebulizer is, but we gotta do a nebulizer. I'm about to set that up, but I thought I'd show you just a glimpse of the other things that we have to do. This bucket is my prescriptions. Some of them. This bucket is some of them also, as well as but then just some like over-the-counter stuff that I need. Gotta have that. Just like vitamins, pain relieving cream, due to cystic fibrosis related arthritis. Sleep aid, sometimes you need that, it's just tough to get to sleep. That's just some of it. And then my inhaler, always need that. And then last week I had sinus surgery, and I can't blow my nose for another week, which is horrible. So this guy has been my friend. So that's some of it. I also have, oh yeah, I wanted to show you. That cot right there. That two small jars, 4 big jars on that cot. That's my IV supply, where I keep the rest of this stuff in there. So there's more saline, there's more heparin, there's bandages in there, there's the dressing kits, the stuff in there, and more Huber needles in there. So I'm gonna let this run an hour. I'm gonna do my neb, and then when that's done, I'll come back and show you how simple it is to disconnect from that. Alright, so the amikation just finished. So all I gotta do is disconnect and flush the line. So to do that, I'm gonna clamp the IV and then the line from my port. I'm gonna lower IV pole. And then just unscrew. Pull that off. And like I said, that IV tubing is one use, so that just gets all thrown in the trash. That's all set. Now I have to clean the line, flush it, make sure that there's no residue left in the line, especially blood. So I have my saline and heparin, preparing those right now. Heparin is just a blood thinner. Hands again. Grab my alcohol wipes. It's the same process as before when I flushed the line. Just wipe. Saline first. Push in and screw. Unclamp. Now, I was always told to clamp at positive pressure, so that means just about when I'm done, as I'm still pushing, I'm going to clamp the line. Alcohol wipe again on the cap. Use the heparin. And that's it. Fairly simple. It's not that complicated. Now I'm all set until my next dose of my other medication, which is in 1 hour. And then it's the same process every time. The acronym that they use is SASH, saline, antibiotic, saline, and heparin, and that's it. Like I said, fairly simple, not that complicated, but that is what it's like to have to set up and do IV antibiotics. That's it. Bye.